Assalamualaikum warahmatullahi wabarakatuh. My name is Devi Oktaviani Devari, and here I will explain about my topic. The title of my topic is psychogenic disorder. Life is valid with various forms of very unique human behavior patterns. One of the unique patterns of human behavior is speaking with stutters, which is a condition where the stutters has a speech disorder. People who stutter usually repeat syllables or prolong the pronunciation of a word when speaking. For example, as experienced by Maya Angrani, she has a difficulty when she is talking to someone because of her stuttering way of speaking. Sometimes she feels insecure when she is communicating directly with someone. Said that the cause of her speech disorder had acquired when she was 7 years old, when she was presenting a speech reading at a farewell event for kindergarten, because there was a pressure in her mind because of her insecurity. So she made a mistake while reading the speech, and unexpectedly from the next day, the way she spoke slowly began to change. She felt confused when she wanted to say a word as if she was being watched by many people. She kept repeat his word while complicating what to say next. According to the doctor research that I was looking for, the cause experienced by Maya was a psychogenic disorder, which is stuttering disorder caused by trauma or problem in thinking or reasoning. In this case, stuttering has physical symptoms experienced by stutters, namely trembling lips, excessive blinking of the eyes, facial tension, frequent cleaning of the hands, and wrinkle facial muscles. Symptoms of stuttering can worsen when the sufferer feels tired, stressed in hurry, or even too excited about one thing. In medicine, the way to diagnose stuttering is by observing the patient, and some things to observe are, for the first is early appearance of symptoms of stuttering. The second is undergoing medical treatment. The third is whether or not there is an impact in daily life. The fourth is a history of disease that can trigger stuttering, such as Tourette syndrome. And the last is change in speech, usually done by doing a reading test aloud. And how to treat stuttering? The treatment for stuttering varies from person to person, or is usually adjusted according to the result of the doctor examination. This medication cannot completely eliminate stuttering, but they can help people with stuttering controls their symptoms. The following are some the methods used for the treatment of stutters. For the first is talk therapy. This therapy focuses on reducing the frequency of symptoms of stuttering when speaking. Patients will be instructed to minimize the appearance of stuttering by speaking slowly, controlling breathing when speaking, and understanding when stuttering will occur. This therapy can also relieve anxiety in patients who often appear when communicating. Uh, okay, the second method is using special equipment. Patient can use special equipment that aims to control symptoms. One tool that is often used to control the symptoms of stuttering is deaf or delayed auditory feedback. These tools work by repeating what the user said, thus, thus making the user seems to be talking simultaneously with another person. Okay, the third method is we can use cognitive behavior therapy. Cognitive behavior therapy aims to change thought patterns that can make stuttering worse. In addition, this method can also relieve stress and anxiety that can trigger strangely. There are no drugs that have been proven to treat stuttering in children. Parental involvement is very influential. Understanding how to communication well with a stutter can help in improving the patient's to the patient conditions. Some things that can be done to communicate it effectively with people with stuttering are, for the first is listen to what the patient has to say, make natural eye contact with a patient while speaking. The second is avoid complicating the word the patient wants to convey. Let the patient finish his sentence. The third is choose a quiet and comfortable place to talk. If necessary, arrange a moment when the patient is very interested in telling something. The fourth is avoid reacting negatively when stuttering research. Make corrections gently and praise the patient when conveying a point fluently. The last is speak slowly. People with stuttering will unconsciously follow the speed of speech of the other person. If the influencer speaks slowly, the patient will also speak slowly, so that she can more smoothly convey his meaning. Complication of stuttering. There is no evidence the stuttering can cause complication in the form of other diseases. Complications that commonly occur due to this condition are, for the first is loss of role in school, work, and residence. The second is be a victim of bullying, and the third is have a low self-confidence. The fourth is restless when speaking, and the last is avoid activities that involve talking. Okay, that's all about my topic. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.